Countrymen and women, comrades and friends, good evening and welcome to Election Update. And the question before us today is corruption or COVID-19? What's killing our people? Corruption or COVID-19? What's killing our people? I'm your host, Mainda Simataa, also an aspiring candidate as councillor here in Kamala Ward 5 in Osaka. Now, I feel it's very, very important to address this issue of COVID-19 in relation to the elections. And as I always tell you, to say that on this session or episode where I give an insight and analysis of all kinds of issues related to elections, this is the only place where you can get the truth. This is the only place where you can get not only news, but also analysis and interpretation of that news. Because it's not just enough to be told to say, so many people today were admitted because of COVID, they have tested positive, and so many people have died, and so many people have recovered. We need to know what is really going on in terms of COVID. And so I'm here to address these issues. Feel free to post your comments and reactions. I'll try as much as possible to address them. And if you're on YouTube, simply like my YouTube channel. And your Facebook, and update you on issues in the nation of Zambia, and issues affecting you. So let's get into it. Did you know that frontline staff, or the nurses and doctors and health staff that are in hospitals fighting to save lives, did you know that they're getting 10 kwacha risk allowance? 10 kwacha risk allowance. 10 kwacha risk allowance. That's how much they are getting. 10 kwacha risk allowance. When I saw it, when I got the information, I couldn't believe it. But that's what it is. How do you motivate someone who's risking their life to save lives with a 10 kwacha? Did you also know that the Ministry of Health has no capacity to vaccinate the entire population of Zambia? And did you know that themselves, those that are in leadership in the ruling Patriotic Party, did you know that all of them have received not only the first dose, but also the second dose of vaccinations? The World Health Organization rolled out a program where they said, we are going to fund countries that are unable to afford vaccines. They gave free vaccines. They have already been vaccinated. They have received their 2 doses. But not even 1% of the Zambian population have received that vaccination. I'm not interested myself. Even if they came to my house to say, can we vaccinate you for free? I would refuse. And I'll give you the reasons why I would refuse. So let's get into the question. Corruption or COVID-19? What is claiming our people's lives? And I'm going to put it to you that the PF regime, the PF government, are a greater danger to society than COVID-19 is. I'll put it to you that people have died in hospitals, not because of COVID-19 itself, but because of corruption, because of the negligence and the breaking of the system, of the health system, that causes people to die. That is what I'm going to be putting to you, and I'll give you points. I'll give you valid points, which therefore yourself you can also think about them and go through them or counter-check to come to a conclusion. Because come August 12, you are going to be voting on the COVID question. In America, elections were lost and won on COVID. Joe Biden won the elections simply because he had the robust program for COVID. It's about lives. You can't talk about bettering the lives of Zambians before you talk about saving their lives. And we are in a position where this pandemic has overrun the health system. So let's look at corruption. In 2019, remember in 2019, the FIC, or the Financial Intelligence Center, released a report that 5 billion kwacha, or the equivalent of the Ministry of Health budget, was looted. It was stolen. 5 billion kwacha, an equivalent of what it takes to fund all the activities and operations of the Ministry of Health, where you and me go when we are sick, where our mothers and our sisters go to give birth, where we are taken when we die, where we come from when we are born. That ministry was robbed of an entire budget in 2019 under the same PF government and its leadership. What is the impact of that? An entire ministry's budget worth 5 billion kwacha robbed, disappeared, went into people's pockets. We are talking about corruption, and I'm giving you points why I think and why I believe that corruption is the bigger problem than COVID-19. The honeybee issue. It's fresh in memories. But before the honeybee issue, there was also the medical stores issue. Remember the medical stores issue where $200 million worth of drugs and supplies vanished. They went missing. Of course, they went into people's pockets. No investigation. Nobody has ever been held accountable for that. And that was during the reign of Dr. Chitalu Chilufya, the disgraced doctor who was eventually dismissed because he stole too much. Medical stores saga. That is an act of corruption. And corruption is a mass killer because the money that is looted can save lives. That's number 2. The medical stores saga. $200 million worth of drugs disappeared. And today we are being told there are no drugs in hospitals. Number 3, the honeybee scandal. Remember the honeybee scandal. This is where the Minister of Health was robbed because it was supplied with rotten drugs and rotten condoms. That is the honeybee saga. An entire ministry was supplied with fake drugs, useless drugs. If that is not criminal, then I don't know what is. The honeybee scandal. Fake drugs and fake condoms. And today, we are probably poisoning people in hospitals with the same drugs that they are being given, because those drugs, I don't recall them being withdrawn. They are still in the system. They are still going in the far-flung areas where the PF is boasting to have built so many health centers and upgraded hospitals. Those, I call them white elephants, because you are building structures that have nothing in them. No medical staff, no drugs, no facilities. And you want people to be proud of that. Number 4, we can talk about corruption through robbing of donations. Remember, just when this COVID thing caught fire, Trade Kings came on board and donated over 300 million kwacha. Other institutions, government institutions and private institutions, they all donated something towards this fight. Today, they are not donating anything because they realized to say that all the things that they were being, all the monies and the facilities and goods and whatever they were trying to donate to help the government were being looted. They became private property. Donations. Jack Ma, the richest man in China, philanthropist. Jack Ma donated not just to Zambia, but to the entire continent of Africa. Masks, these things. They come from China, donated, courtesy of Jack Ma, the richest man in China. Donated masks, ventilators, syringes, all PPE, personal protective equipment, all the facilities that you need to fight COVID were donated in large quantities. There was a first donation and there was a second donation. We were only told to say that the donation from Jack Ma has arrived in Zambia via Ethiopian Airways. Where it landed, where it was taken after that, nobody knows. Today, people are dying in hospitals in their hundreds because money and donations that were meant to facilitate or take care of the health industry went missing. Now, if corruption is so rampant the side effect or the resulting effect is that you end up with a broken down health system. And I'm coming to that. The broken down health system. I've been telling people to say, if you are tested, you found positive with the COVID, I've been discouraging people to go to hospitals. And I was attacked because of that. And I said, if you are tested positive for COVID, please don't go to hospitals, because Zambian hospitals are death traps. You all know of someone who went to hospital, they just had a little headache and a little flu, a little discomfort. They even drove themselves to the hospital or managed to go there. They were all right. 24 or 48 hours later, what do we hear? That person has passed away. What is going on in those hospitals? A broken down health system. No wonder why when these ministers and PF cadres and all these people who are in leadership in the PF government, no wonder when they get sick, they can't dare go to any hospital. The least they can go to is a private hospital. Those are the only ones they can go here locally. Otherwise, they'll fly to India. Or they'll fly to Johannesburg in South Africa. Morningside Clinic. Maryland Clinic. That's where they go to be treated. Even from COVID, they will fly out at taxpayers' money, your money, to go and be treated. Because the health system in Zambia is run down. It's broken. It's a death trap. And if you are listening to me, I'm still advising that if you test positive for COVID or if you have any symptoms, please stay away from the hospital. Don't go to the hospital, because 95% chances are that you die. Not because of COVID, but because the system there is broken down. And we are hearing these stories. We've heard of people who are admitted. There is totally no care. Nobody's looking at them. A run-down health system. Because of what? Corruption. And I've cited to you 4 instances or examples of corruption. The FIC report of 2019 where 5 billion went missing. The honeybee scandal. The medical stores scandal where $200 million worth of drugs went missing. And I've also told you about the theft of donations from Jack Ma, the richest man in China, donated to Zambia. And the things that he donated have never been seen. So let's look at what is happening in these hospitals, because people have to know the truth. The permanent secretary, I was going to say the minister, but the ministers, they have been dissolved. Parliament was dissolved and they are no longer ministers. The permanent secretary, the chief executive officer of the Ministry of Health, I was going to talk about him. But you see, what is his function? What is his role? I don't even know his name. I don't even care to know his name, because he's not doing anything. His only job is to wake up in the morning and ask his staff how many Zambians have died from COVID-19. How many people have contracted COVID-19? How many are we burying today? And how many have recovered? That's his only job. To alarm the nation with inflated figures of COVID-19, of deaths, so that you and me can be alarmed. That's what they are there. Why? Because it pays. COVID pays. They are COVID-preneurs in this country. COVID-preneurs, not entrepreneurs, but COVID-preneurs. They are COVID-preneurs in this country. People who are making a profit off the deaths of other people. We are talking about the health system that has been run down because of corruption. And what is happening in those? Number one, the number one effect of such a run-down system is that you have shortage of staff. Shortage of nurses, shortage of doctors and other support staff, clinical officers, name them. There is a shortage of this stuff. And these people are dying. Doctors, we were told that 7 doctors have died. Nurses are dying because of inadequate support systems in a shortage of staff. As if they don't know, these are the people who fired Dr. Sampa for simply asking that doctors be paid their dues. They are settling in allowances so that their pay scales can be upgraded in conformity with their positions. Labor issues, labor disputes. and you fire a doctor. Dr. Sampa was fired. In the midst of a COVID crisis, when Zambians out there are crying for more doctors and nurses to save their families, you are firing doctors. You are intimidating nurses. You are firing health workers instead of employing more. I've said it again, and I'm saying it again. I never thought I would live to see a day where I would see an unemployed doctor or an unemployed nurse. These are surefire careers. Even parents who are sponsoring children to go do nursing or doctors, they know to say that the moment that these people complete, in fact, you don't even need to. You start working before you even complete or qualify because of the urgency of the need of health staff. There is a serious crisis of health staff, shortage of staff, and we have been exposed now because of COVID. The World Health Organization standards say that to every nurse, there should be 5 patients. To every nurse, there should be 5 patients. What is the ratio in this country? Let's not even talk about doctors, because the current ratio is it's crazy. To every 100,000 patients in Zambia, there's only 1 doctor. Some people will die without ever being touched by a doctor. That's how bad things are in this country. You call Zambia, where the PF regime is boasting about progress and development. They are firing doctors. Nurses are unemployed, doctors are unemployed. The moment they say, give us our dues, fire them. And I'm citing, these examples I'm citing have happened in 2 centers where I've had the privilege to go and see for myself what is happening. The Baulen COVID Center and Levi Mwanawasa COVID Center. That's where these things are happening. They are understaffed. If you go there, you're going to find one nurse, one exhausted nurse who's been working tirelessly, looking after 50 patients. What do you expect? These people are not superhuman. They get frustrated, they get tired. They'll slack off. We have instances where people are complaining of a lack of equipment. There is no COVID fighting equipment. We are told that how many ventilators does UTH have? 12. Last time I checked, 12 ventilators. The biggest hospital in Zambia has only 12 ventilators. And I'm told some of those ventilators, you find them in private clinics which belong to ministers. Eh? Don't be surprised ventilators in private clinics. And there are